Most people live all or nearly all of their lives in mainstream housing, homes that were not built specifically for a particular age group. And as we age, physical impairments or disabilities that make day-to-day life more difficult become more likely. Despite common assumptions that most older people want to downsize or enter specialist accommodation as they age, when it comes to choosing a home, they are motivated by the same desires as other age groups. Housing quality and suitability has a direct impact on the health and well-being of the occupants of the home, and a suitably designed and/or adapted home can extend independent, safe living in later life, and thereby housing supply and the design and stock condition can help manage more effectively the delivery of or reduce the delay in demand for social care. Therefore, the key characteristics for age-friendly housing are: they must be adaptable to allow one to age within the home independently for as long as desired. They must be accessible, so this means the property must have level access to the entrance, a flush threshold, sufficiently wide doorways and circulation space. Safe and accessible homes can maintain or improve health, well-being and social connections as people grow older and greatly improve the quality of life. Most homes are inflexible, unsuitable, people with mobility issues, and hard to adapt. And as our populations age, this becomes a problem for more and more people. Today within the UK, there are actually over 1 million more households headed by someone over the age of 65 than there were in 2010. However, less than 1 in 10 houses have the necessary features that make them suitable for people in wheelchairs or with mobility issues. A crucial part of this flexibility is supporting people to install the aids and adaptations they need, from level access walk-in showers to grab rails and even stair lifts. Part of this is about increasing the range of products available to consumers, ensuring these are attractive and desirable features that people want in their homes, rather than the clinical, stigmatising products that currently exist. Home adaptations also allow people to remain in their home for longer by helping them stay active and independent and helping improve well-being. Research has found investment in adaptations to be highly cost-effective. Relatively low-cost home modifications have been shown to reduce the number of falls that require medical treatment by 26%, that is in the UK. And also when you think about new homes, we need to ensure they are built to basic accessibility standards. Building new homes to a decent standard and future-proofing housing stock means that more of us will be able to remain independent, safe and well in our homes for longer. Our Home Coalition, the Housing Made for Everyone campaign, is calling for the government within the UK to set a higher regulatory baseline for accessibility of all new homes. This will provide a level policy playing field across our country and the certainty that developers want, enable them to build homes that meet the future needs of our ageing population. Building new accessible homes that are better designed, not only for older people but also disabled people of all ages, is an important part of creating a more age-friendly built environment. However, 80% of the homes within the UK are already built, living by 2050 are already built. And so retrofit, particularly in the UK, has a potentially far greater impact on achieving this objective. However, we are faced with another problem when carrying out retrofit. One of the biggest issues facing individuals as they age in their home is the shocking number of poor quality homes that not only aren't accessible or adaptable, but they are not safe. As a way of addressing this problem, Ageing Better have sponsored an independent inquiry into the poor quality homes within the UK. It is entitled The Good Home Inquiry and it will run until 2021. The aim is that it will explore why so many of England's homes are in poor condition and hazardous to health. This will include analysing past and present UK housing policies, wide-ranging consultations with experts and housing sector stakeholders, and talking to people with lived experience of living in a poor quality home. The inquiry will make evidence-based recommendations for new and amended housing policies that would make it easier to upgrade, maintain and improve our homes. The purpose of this inquiry is to support the Centre for Ageing's Better goal of reducing the number of homes as non-decent by at least 1 million by 2030. Please do follow the work of the inquiry on our website agingbetter.org.uk. Thank you. Integrated local action in the fields of housing and planning can align some of the most important policy areas currently challenging national and local governments, and we recognise that. So therefore, at Ageing Better, we have a network of 41 local areas that we work with to learn and develop our position on age-friendly housing. We also have 3 areas which we have official partnerships with. These are Greater Manchester, Leeds City Council and Lincolnshire County Council. The purpose of these local partnerships is to work with the local authority to research and trial new innovation. We strongly believe a lot of answers to the problem of age-friendly housing lies in the understanding the local problem. Each geographical area is very different, from type of housing, age of the housing stock, and simply the wants of its citizens. An example of the work Ageing Better in this area is our Right Place project based in Greater Manchester. This project sought to better understand the availability and accessibility of older people's housing options in the city region. It examined the relationship between personal housing aspiration and both the existing and potential housing offer for older people within Greater Manchester. It used specific sites as a focus to create a method for wider application. It explored the relationship between large housing-related population datasets and place-specific qualitative analysis, alongside engagement with older people. The research findings have unfortunately been delayed due to COVID-19. However, the questions we hope to answer once it's completed is, and the ones we would say you need to ask yourself within your local areas are, what types of houses are adults currently living in with that area? What types of housing do people move to? And this should be based on actual data. When they move, who moves into the houses they vacate? What are the barriers that prevent people moving? Is there a lack of supply or demand? And what incentives and advice and support is needed? Out of this work, Ageing Better will work with Greater Manchester to scope and design a potential solution to incentivise the movement of older households into mainstream accommodation which is suitable for their future needs and encourages appropriate housing in later life. Whilst understanding the local picture is extremely important when planning for age-friendly houses, key to its success is surface integration with health, social care and wider housing provision. Examples of integration include providing fast-track home modification grants to speed up hospital discharge and home adaptation linked staff in hospitals to integrate with acute services. However, despite the obvious interdependencies between health, housing and social care, these connections are not yet fully recognised or reflected within wider policy within the UK. Therefore, we recommend local leadership across health, housing and social care to develop a shared objective of helping people to live independently in a home that is suited to their needs as they age. This objective should be embedded within policy frameworks, sustainability and partnerships, and local national health system plans. As I previously mentioned, at Ageing Better we believe home adaptations are a highly effective way of adapting the UK housing stock to meet the needs of older people. Previous research commissioned by Ageing Better highlighted the positive and life-changing impact home adaptations can have. The initial review found strong evidence that minor adaptations improve outcomes and quality of life for those in later life, particularly when combined with necessary repairs and home improvements, lived in a timely manner and in line with people's personal goals. Therefore, in 2018, Ageing Better commissioned Care and Repair England to conduct research into good practice in innovation, home adaptation and repairs throughout England. The report identified the elements of high quality and innovative practice and provisions of housing for older people. The factors which constituted good practice included raising awareness of what is possible amongst older people and professionals, including the availability and benefits of home adaptations, helping older people navigate the system to access adaptations advice, funding, practical related and related services, speedy delivery of home adaptations, involving older people in home adaptation service design, linking adaptations with home repairs, and taking a preventative approach. If you would like to know more about the good practice throughout the UK, please read our full report entitled Adapting for Ageing, Good Practice and Innovation Home Adaptations. This is available to download on our website. Thank you for watching today. If you have any questions or would like to know more about the work I have touched on, please do contact me on millie.brown@aging-better.org.uk or check out our website. Thank you very much.